Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Waqar. So today I am going to tell you about the right approach for the MRCPCH Clinical Exam. Focused study is very important to pass the exam. Otherwise, there are two ways to pass the exam. There are two ways. For example, one, you have to be focused and you should have fully prepared for the exam. The other way is you are going to appear in the exam and unfortunately you cannot pass, and you will get the experience from your previous exam and the next attempt, or maybe after that another attempt, and then you will pass finally. So it's better, you should have to be the focused and exam oriented study. So this is the clinical exam. It is keep in mind, this is the clinical exam, not the theory exam. So which is different. Clinical exam is different from the theory. Already you have passed the clinical part, FOP, TAS and AKP. So now this is the clinical exam. So this clinical exam is different. The common mistakes during preparation of the exam, there are a lot of material of clinical examination. If you will ask from anyone who has passed, definitely whenever you need guidance or the knowledge, you will go to the senior one who have passed the exam, and everyone is giving their own experience, and at the end you have a lot of material to study, but unfortunately you cannot complete all the material. So I will tell you what to study and how to study. The clinical exam is it is a clinical, not the theory, and it is an expressive exam. So it's not the receptive. So you have to express yourself, because they need your body language, they need your facial expressions, they will look at your tone, they will look at your appearance, how you communicate, everything they are observing in the exam, and everything is the marks. So if you have, I have seen the brilliant candidates, they are very brilliant and they have a lot of knowledge, but unfortunately when they go to the exam and they cannot, for they don't work on their other things other than the study. So this is also a big reason of failure. And study material, as I told you, you should have to be focused. There are a lot of notes. I know there are a lot of notes. You can refer anything you want, but the recommended books, which is Mark BT, I will let you know how to approach the Mark BT book. So the importance of the discussion with the study partner is it's vital uh, for the expression, because you have to express in the exam, you have to speak in the exam, you have to talk. It's not like that you will listen and you will answer in the yes or no or in the one line. No, you have to act. So how you would you act if you are not in practice? So you should have to be in practice. You should have a study partner to discuss with them, to tell them about the cases. You should have a time management. There are only, for example, in clinical you have short time for discussion, 3 minutes only, and in 3 minutes what are you telling it to the examiner? In 3 minutes you have to tell about the case. For example, your positive findings, you should have described your examination, and you should give the management plan, you should give the uh, also what advice you will give to the parents, and investigation, treatment. So these are only 3 minutes. So you have to be in manage the time. How would you manage the time if you don't have a study partner and before you are not in practice? So it is very vital to have a study partner, and you should have be an expressive with them. So how to approach the Mark BT, which is recommended book? It is the MRCPCH clinical book. Usually they are saying Mark BT, the two other authors as well. So this book is contains all areas. For example, they have the cases, history taking and management, plan, communication skills, and also they have the development and the clinical. So content of this book is history taking and management planning station. For example, they have some scenarios, long cases and also short cases. And it has, I will tell you about the long cases and short cases. The communication skill stations, also you should have to be exam oriented. You need an exam oriented, how you will conduct an interview, your appropriate explanation and negotiation with the role player or the mother, anyone who is in the exam, and accuracy of information. So these are very important. In the clinical exam, in the clinical stations, you have a cardiovascular system and abdominal and respiratory system, neurological, neurodisability, then musculoskeletal and other station. In other station, you have the hematology, dermatology, endocrinology and growth and nephrology. There are a lot of material to cover, how to cover all the material in short period of time. And you have the developmental station as well. So let's go to the history taking and management planning station. So it's not only history taking, it's a management plan as well. So you should have to take the history, and history you have certain time to complete your history. It's not like that you will took the, it's the art, history taking is the art. If you are taking history and for example you have a took the history presenting complaint for our past history, and during first 9 minutes, now you have 3 minutes remaining. So in during last 3 minutes, if you are taking the presenting, if you are asking about the presenting complaints, which is not appropriate, examiner may cut your marks. So you should have to be uh, in order. You should have to be ask the history according to the, it is art, as I told you, the presenting complaints, past history, family history, all this in order. We will discuss in the next video as well. So history taking and management planning station, in Mark BT you will find there are 6 cases. There are 6 cases total, which are long cases, and there are some also short cases as well. So you should go through these all 6 cases. Those 6 cases are very common, and it will give you also the good knowledge for the clinical as well and other stations. So remember one thing, that for the management planning and the investigation, you should refer to the latest guidelines. So you can read about the disease, pathophysiology, about the other thing from this book, but remember one thing, you should have to refer latest guidelines, now 2024 or 2024 or 2025, latest guidelines for the treatment and investigations and the management. So these are the cases in long cases, and there are some short cases as well in this book, and you should study well these long cases, and it is well organized in this book. If you will study, you will understand what is going on. There is in the management planning, for example, the non-medical management and the medical management. You should aware of the non-medical management and the medical management as well. So it's well, this book is very good to read. Okay, then we'll go for communication skills station. So for some candidates this is the difficult station, and for others it might be the easy station, because some candidates usually they go other stations, they will get the good marks, but in the clinical and communication skills station they are losing the marks. So in this station I will try to make it easy to tell you how to approach this station. Before that, please subscribe my channel for further informative videos which will help you in your exam. So communication and skill stations, it has, as I told you, what they are observing in the communication station. They observe your conduct of interview. How would you conduct the interview from the role player? And this communication is a big mistake candidates are doing. They are calling the role player with the different names, because you have the scenario from the outside and name is written, the child name, and you are talking to the mother or you are talking to the father, and the mother name is this and father name is this, or father name is this and child name is this. So many candidates, because of exam stress, when they enter in the room, they call the mother with the child name or the other name. So this is the thing which examiner is watching. So you should you have the time outside, it's better to write down on the paper. You must have the paper there and the pen, so you can write the mother name in big capitals and the child name when you enter, so don't be confused. And this station, when you enter in the room, examiner will not tell you anything. So you should have to start from entering the room, and from entering the room you should have to start, and examiner will observe you once you enter in the room in communication skill stations. The other station in for example in clinical exam, examiner will give you some information about the patient. This is the patient, he has had this complaint, I want you to examine this. If you are not understand, you can ask again. But in communication skill, no, you have to uh, start from the entering in the room. So be conscious and be aware of this thing. When you are going to enter, just assume that your station has already started and examiner is observing you. So appropriate explanation, whatever scenario you have, it is very important. If you should have to give the appropriate explanation, not the inappropriate explanation. And negotiation, what does this mean, negotiation in communication skills? Because sometimes parents are demanding, they need investigation, they need antibiotics, they need the unnecessary procedures. So this is a negotiation. It's not the shop you will negotiate, but with the patients according to their demand. So you should have the skill that how you should give them information so that they become satisfied. And accuracy of information, this is also important. If you don't know, it's better not to tell. If it is not accurate information, they will cut your marks. So it's very important, the accuracy of information. So they have the 6 areas actually in communication station. 6 scenarios they might give you. Number 1 is information giving. So information, first of all, I will tell you that they have the scenarios in the Mark BT and the other book as well. So this scenario you should read. After that, the main thing is the jargon. You must heard about the jargon, means the medical terminology you are using, which is not acceptable that with the role player. So you should not use the jargon. So how can you get the information? So there are two trusted websites, for example, two websites which you can refer. If you will write any topic of the communication, at the end you can write the NHS or patient info. So there are two websites which will give you the information in the patient's language, and you can get a lot of information. The NHS is very easy. On one page you can get the all information of that disease or that topic, whatever it is, and that information, and it is easy that you can convert in their own language, or you can get the same wording as well. So information giving, for example, explanation of the new treatment and the breaking bad news, for example, any disease, or for the child who has having history of syncope and did the ECG, maybe he has a WPW, so you have to give the bad news to the parents. You should have the art how to give the bad news and what question you can face from the parents. And the consent, it could be because of LP consent or bone marrow aspiration, any consent scenario. In scenario who are the scenario of consent, if you did not tell the role player or the mother, whoever it is, that I am here for the consent, at the end of our discussion, or even at the end of completing of your all scenarios, you should say I need your consent for this procedure. Or if you will say initially that I want I'm here to take consent from you, we are going through this procedure. So these are the things you should keep in mind. If you did all the scenario and you did not say I need a consent, so you will lose the marks. Critical incident, for example, medical error, apology scenarios, these are the difficult scenarios, and the parents or the role player, they have very difficult questions. Many candidates are losing marks in the critical scenarios. The ethics, in ethics, for example, there is no answer what is right and wrong. You don't know. There are some areas there is no right and wrong. So these are the ethical scenarios, and these scenarios also can come in the exam, and you should be well aware of it. The education for the parents about the disease, about the condition of the child, the education you are giving to the medical student or the junior doctor. So this also need the accuracy of information. So these are the scenarios you will topic of scenarios you will get you can have in the communication skills. So these are some communication scenarios in this book which we discuss Mark Beatty, like the breaking bad news or discussing an ethical dilemma, so obtaining consent, duty of candor, talking about the chronic conditions, giving information. So this is telephonic conversation. I don't think so they are giving nowadays, but giving information, you should have the role player there in the exam. So always always read the guidelines for the latest treatment, investigation and management. This, don't forget this one. You can read any kind of notes, any kind of books, but you should have to go for the common diseases, common things which comes in the exam. Go for the guidelines. The for clinical stations, and for many doctors, majority of doctors, this is a difficult, it is very difficult stations, because if you will are perfect in all others, like two video station, two communication station, one history, one development, you will get a lot of marks. But then you have the four clinical stations, and these four stations says how many marks total? 32, 8 each. So four stations, 8 is 32 marks. So these 32 marks are important. If you will lose, for example, sometimes some candidates, they will get the 1 mark for their the blunders maybe. So they might lose the exam. So uh, it's not impossible, but it's really there. You will get 100% marks in all other station, like the development, history, communication and videos. So if you got the 100% marks, then it's okay. In clinical, if you will lose one station and other station, they will give you the half or more than half. So you might get the passing marks. But this clinical stations are sometimes for many candidates are very difficult. This clinical development and communication, many candidates, majority of candidates are saying these are the stations they are suffering for. So cardiovascular, they are giving the cardiovascular scenarios, abdominal and respiratory, neurology and neurodisability, and the musculoskeletal and others. So in others, you might have the cases of the hematology, could be dermatology, could be endocrine, growth, or could be nephrology. So these there are a lot of information in this book. It's not necessary that you will read each and every page. So my advice for you, go by the cases. For example, if you will have you discuss with your study partner that we are going to discuss this case of VST, or for example coarctation of the aorta, for example the child who is having AVST. So you will go from this book, go for the those case-wise studies. So this case-wise studies will help you. You got the, for example, the child who is having cystic fibrosis, and you have the abdominal examination. So you should know, our respiratory examination. So if you will go for case-wise studies, it will help you. Otherwise, it's I don't think so. It is the good approach that you will go page by page, and at the end you will not get anything. So it is better that you will have a case-wise studies, topic-wise studies, and you refer this book by the topic-wise studies, which will help you. Definitely other material you need. It's not that 100% you will prepare from this book, but this book is good to have the study, and it will give you the good information, exam oriented, and many questions you will find the answers of the many notes are there which are written by the many doctors, and which all are mostly those these notes are written from this book, and which are extracted from this book, and there are other books as well. So this is the for online mock exam, it's better because you are spending your time, you are spending your money, you are spending also you are taking the stress of exam stress. Definitely you became antisocial for these few months, and if you are not prepared, or if you are not confident in the exam, maybe you will fail the exam, and definitely you have to appear in the exam, and again you have to start all these process. So it's better to take the mock exam to make confident and with anyone, and it will give you the confidence, it will give you that how to express in the exam, and it is good that you have a mock exam. So for the mock exam, if you can contact me at any time, and just WhatsApp me on this number, or you can email me. If you have already accepted for the exam, it's better that if you have a one month remaining in the exam, or 2 weeks, this is a good time to have the mock exam, so that you should have the feedback of the your to whom you are taking the mock, and you should work on your weak areas. So you have some strong areas, everyone has some strong areas and some weak areas. So these strong areas and weak areas assessed by the senior, which is they will give you the feedback as well, that your weak area is this, you should work more on this area, so that you can have the appropriate study. If you have any question, any query, you can also have you can WhatsApp me or email me, and also subscribe my channel. Thank you very much.